So today I'm going to talk about a recent study that just recently came out about partial rotator cuff tears. Hello, I'm Dr. Leon Popovitz. Thank you for joining us. So there's a difference between full thickness rotator cuff tears and partial rotator cuff tears. The rotator cuff are a group of tendons that control the motion of our shoulder. This tendon here, for example, is the supraspinatus tendon and attaches to the upper portion of our arm bone called the humerus. And you can see here that tendon has fully torn through and through. But if we look at this photo is a partial tear. You can see how there's a rent, a partial tear in the tendon, but the tendon has not torn off the attachment. That's really the key. The tendon has not torn off the attachment. The initial treatment for a full thickness tear versus a partial tear is a little different. If it's a full thickness tear, especially if you've had trauma, and especially if you have trouble raising your arm altogether, or even if you're able to raise your arm for the most part, where the other tendons are compensating. But if you're young and if you have a traumatic full tear of your rotator cuff tendon, more often than not, that ultimately requires surgery to repair it. And it can be done arthroscopically, minimally invasive. But if you have a partial rotator cuff tear, the initial treatment more often than not is non-surgical treatment. Initially, it involves rotator cuff strengthening with physical therapy, stabilizing the wing bone, the scapula bone, and postural exercises. If you don't get better with conservative treatment, non-surgical treatment for a partial rotator cuff tear, then we often proceed with surgical treatment. That surgical treatment can be a variety of things, methods. One method is to repair it what's called in situ. Just sew it back up as it is. Another method is to take that partial tear and complete it, turning into a full tear, and then repair and treating it, and then subsequently treating it like a full rotator cuff tear and making a full repair. More recently, there's been an advent of what's called collagen matrix implants. These are basically collagen standard placeholders for repairs to grow. So for that tendon to regrow, or any tissue to regrow. It can be used for different types of tissues. But that's become a relatively new method of treating it, where we're putting in this kind of matrix, this little patch. And this patch is a bed for healing tissue, and very often that partial tear will connect and heal. Now, this study compared all three of these surgical treatments to determine which of the three is better. The conclusion is all three of them were effective and equally effective. So the bottom line is, if you have a partial rotator cuff tear, try, more often than not, everybody's unique, but very often we try conservative non-surgical treatment. If it doesn't get any better, many surgeons have different methods of doing things. Some surgeons like to just repair it in situ, right then and there. Some surgeons prefer to complete the tear, and some surgeons have been now using the biocomposite collagen matrix. I've always been under the preference of completing the tear and repairing it fully. This way you don't take any risks. You know for sure it's repaired well and it's holding on well. My concerns are when these partial in situ repairs may not grab on, the attachment may not be as secure to the bone that way, and the healing from the bone, the blood coming from that bone, is so effective. It really is such a wonderful way for things to heal. That's why I prefer the complete. Completing the tear and then repairing it fully. I have not been very much in favor of these collagen matrix implants, though I have nothing against them. They may be very, very effective, and this study actually shows it's very effective. The study shows that all three methods are actually equally effective. So it's really impressive that this collagen base patch is showing results that are as effective as a full repair. Be that as it may, either one is effective whatever your surgeon is most comfortable with is probably the best thing to do, and whatever surgeon you're most comfortable with is the best surgeon to go with. Just a note on partial rotator cuff tears. There are essentially two different types of partial rotator cuff tears. There's a tear that occurs on the very top. I'll go back to the video one more time. There's a tear that goes on the top of the rotator cuff, which this picture shows. And that often can happen from overuse, where this bone here rubs against the tendon and cause it to wear down. Very often it can pinch against a bone spur that develops in this area here. But sometimes people have instability of their shoulder. And the instability where the bone below, where this bone here below, pushes up against the undersurface of this rotator cuff. And this little rent, this little partial tear occurs, and if it occurs on the undersurface, that's usually from shoulder instability. Shoulder instability is often in younger people, because as we get older, we do get stiffer. So the likelihood of your shoulder recurrently dislocating is less common when you're older. So your partial rotator cuffs on the undersurface, what's called the articular surface of the rotator cuff tendon, where the humeral head pushes up against it, rubs against that undersurface of the tendon. That usually occurs in younger people. Younger people, typically under the age of 50, is a relatively good gauge. It can occur over the age of 50, but not as common, not as common. And more common, it occurs in teens, but in particular in your 20s and 30s. Those type of partial rotator cuff tears, again, usually come from that instability. And when you surgically repair the instability, the shoulder, you repair it where the shoulder stops dislocating, that often allows that partial tear to heal. So that type of partial tear, unless it's going very deep through the rotator cuff, usually the gauge we have is 50%. So if in that type of tear, you don't need to repair the rotator cuff, again, unless the tear is more than 50% of the tendon. Rotator cuff tears on the other side, on the subacromial space, where underneath that bone above, where the bone spur may rub, those tears sometimes you can treat with a cortisone injection, because often it's from that bursitis and inflammation from that bone spur pinching that area. But if that injection doesn't help, and if that physical therapy doesn't help, then we often turn to surgery, and those tears we repair. Again, the gauge very often for us in both circumstances is the depth of the tear. If the tear is greater than 50%, very often surgery would be warranted inevitably. But again, the point is, for patients who are in their 20s and 30s or in that age range and have articular surface tears due to their shoulder being unstable, those often do not need to be repaired once you stabilize the joint. I'm Dr. Leon Popovitz. Thank you so much for joining us.